Welcome back to the Morning Blend. Vein disease can be complex and everybody is, of course, different. So it's important to find the right treatment for you. And one of the most important questions that you want to ask is, of course, does insurance cover it?
That's right. So joining us now from Vein Clinics of America is Dr. James Gariti, along with Office Manager Jennifer Long. Thanks for being here, you guys.
Thanks for having us. And again, happy birthday.
Thank you.
It's fantastically exciting.
Thank you.
You're working on the champagne.
I know,
I'm waiting for it.
It's slowly getting open. We'll celebrate at the end, right? Okay, so when it comes to your legs and everything like that, you know, people want to, yes, they want to get it taken care of, but so many people, I think, hesitate because they don't know when the right timing is or what their insurance will cover. When do you guys say is the right time to start looking at taking care of those things?
For me, there are a few components to that. One of them is compression stockings are always part of the calculation, and I have a variety of people who have different perspectives on it. I had one lady who said, oh, I really don't want to wear my compression stockings under my jeans because they're not going to look right. But a lot of folks are a little more worried about wearing them in the summer when it's hot. But most insurances have a requirement about trying stockings for a while before they'll let you have treatment.
Gotcha.
And so trying to plan ahead with the stockings, both completing that trial of stockings as well as wearing them after treatments or during treatments, those are some of the considerations that we look at.
One of the things that you mentioned during the commercial break, and I think it's important for people to be thinking about this and maybe even planning in their head, is that open enrollment is happening for a lot of people with insurance where they're making some important choices. And if you need to have veins treated or think that you might need to have them treated, that might be an important part of your coverage to look at and help you in forming a decision.
Yeah, and that's a great point, and that's one of the things we run into. Folks are coming in right now saying, okay, great, I want to get all my stuff taken care of by the end of the year. And it's not impossible, but it's really, really tough to come in now and hope to have it done by the end of the year. Whereas if we plan for what you're going to have in terms of coverages and deductibles and all that stuff for 2015, we can really help try to guide those decisions. And I say, you know, again, I deal with veins all day. It's all I do every day. Every patient is just veins. But Jen, my office manager, all she does is deal with insurance companies all day, every day. She talks to them. She reads their policies. And so she's a great resource in trying to plan out coverages for next year.
Well, as we before we get into in depth some more of the insurance stuff, because I want people to see before and afters of why it's important. Once you get some of this insurance stuff sort of figured out, you've worn the compression stockings, things like that. A lot of times, even if you wear them, you're still going to have issues like this, right? So getting them treated, the after result truly is worth the time invested and then the process of going through and dealing with the insurance, right?
Yeah, I mean, again, there's no question. Most folks have had vein problems for years and years and years. They've developed over a long period of time. The symptoms are not always super obvious. People have achy, tired legs at the end of the day or whatever. And so it oftentimes takes people a while to decide they're going to do something about it. Meantime, the veins are only getting worse. And in the old days when surgery was the primary option, there were lots of reasons why people wouldn't even consider having them taken care of. And nowadays, the treatments are really pretty easy. People are on the go from day one. There's no real downtime. So trying to get the veins taken care of, trying to make their legs feel better, more energetic, lighter, those are all tremendous benefits of starting now and working through the process.
Jennifer, you deal with insurance companies all the time with patients. I'm sure you get a lot of questions. You deal with a lot of the companies. What would be your best piece of advice to someone who needs treatment for veins?
Because you're in open enrollment right now, it's really great because all your employers are going through your different benefit policies that you can choose from, so you can understand your deductible, what is usually required up front, what your co-insurance is. And the great thing is a lot of companies offer either health savings accounts or flex spending accounts, which those funds are extra money that you elect into an account but can cover costs of going towards your deductible and things like that. So you have the money up front to pay for your deductible and treatment and things like that. So coming in now and getting a good idea of what treatment you're going to need going into January in 2015 is going to allow you to elect money into those accounts so you have it up front to pay for your services.
So you can use health savings account money to pay for vein treatment.
Absolutely.
It's wonderful.
How about varicose and spider veins? Are they ever covered or are they always considered cosmetic?
Some insurance companies consider them cosmetic. It depends if there's a deeper vein issue that originally was there. But if it is strictly just a cosmetic issue, you can still use those flex spending dollars and those HSA dollars.
Okay. Because I was going to say, like, even the veins that I had removed, they said, you know, spider veins, cosmetic. But even, I don't know if that means that there's a deeper issue or not, but even with that, I felt relief in the tired, the achy, you know, things like that at night that people said, well, you're just on your feet too much, but they feel better now. So I really kind of, I attribute it to getting rid of those spider and, you know, cosmetic veins.
Yeah,
So
there's no question about it, and I always try to explain the physics of fluids and the pressure that's generated in a column of blood or a column of fluid is based on how long that column is. And so if those spider veins are connected to other veins that are connected to other veins, and you get a longer and longer column of blood, those spider veins can be under a lot of pressure and can absolutely cause symptoms. They're absolutely not just cosmetic.
I'll
It's
attest
wonderful,
to it.
and it's wonderful that you do this as a full-time commitment, is treating veins. Here's the information so that you can call Vein Clinics of America right now, because you can get a complimentary consultation at their Brookfield Clinic. The phone number is 866-618-VEIN or 8346, veinclinics.com. Great number to call to ask your insurance questions, as well as questions that you have about compression stockings, as well as vein treatment. Nice to have both of you here. Thank you so much.
Thank you.
Appreciate it.